This video is for you if you have suffered with headaches that seem to come and go and keep you from enjoying life, neck pain or stiffness that makes everyday life miserable, low back pain that seemingly hits without warning and keeps you bent over and on the couch for days at a time. And this video is especially for you if you have the above conditions or other painful problems and other approaches have failed. Maybe you've already tried medications, physical therapy, chiropractic, acupuncture, massage therapy, and still suffer with pain. Imagine what your life would be like without pain. What would you do? Exercise more, go on trips, spend more time with loved ones, work in your garden again? I'm happy to tell you that for many people this is not only possible, but likely. Gulsel went from severe back, hip, and leg pain for years to pain-free and enjoying life in a handful of treatments. Louis suffered from vertigo and severe head and neck aches at work for months and now works without restriction and enjoys his life. These aren't one-off miracle stories. These are just ordinary people suffering from pain that nobody had found the root cause of. And once that root cause was fixed, their pain went away and their lives returned. Hi, I'm Dr. Barry Marks, chiropractor in Orange, California. I've been treating patients in Orange County since 1986. I've been blessed to help thousands of patients in my career. In this video, I am not going to try to convince you to try chiropractic, make exaggerated claims of holding a deep secret no other doctors possess, make you think I can cure anything and everything. What I am going to show you in this video is the exact process I go through to find the root cause of problems and then find a solution to fix your problem once and for all. At the end, we will see if we are a good fit and then determine if you qualify for the types of treatments we do in my office. Before we dive in, please like and subscribe so this channel can continue to grow. Thank you. Okay, let's get started. So here is my process to uncover the root cause of your problem. Step 1, your story. You might not realize it, but your history or your story contains vital details about your health when you lost it and possible events where pains came from. So we need to spend some time discussing not only your current health, but also your past history and family history as well. Step 2, examining your body. First, I take a wide view to see how your overall body is aligned. Your posture can tell me a lot about how certain joints are working and where potential problem areas lie. Next, I assess the function of your nerves, your reflexes, sensation, strength, and coordination tests. Tell me if your brain is transmitting messages okay, or if the messages are being blocked somewhere down the spine. Next stop is to assess your muscle tone. Are your muscles tight but weak? Are they limp and soft? Do you have knots? Are the knots tender? This information tells me how well your muscles are supporting your body. Then I proceed through various pushing and pulling tests on key joints to look for telltale signs of joint, ligament, disc, and nerve problems. These orthopedic tests narrow down the nature of your condition. Lastly, on my exam, I will use my hands to assess the alignment and mobility of your spine and other joints. This is where I locate the precise location of malfunctions in your body. Step 3, digital x-rays. Safe, low-dose, limited x-rays tell me what my fingers and physical testing cannot see. From your images, I can see your exact alignment and take measurements. I can see areas of prior damage and locate joints that may be arthritic. Step 4, your first treatment. After a quick analysis, I will provide a first treatment, which usually consists of relaxing and pain-relieving therapy modalities, followed by a chiropractic adjustment. How your body responds to this treatment will tell me a lot going into our final steps. Step 5, report of findings. Here is where we sit down a day or two after your initial visit to discuss the results. I will correlate all the information we gathered into a picture of what is causing your problem, what treatments are available, and what your chances for recovery are. Then I will determine if your condition qualifies for the type of work I do. I only accept cases I feel have a high probability of success. I do not want to waste yours or my time. Let's talk briefly about money. You can probably find a $29 special for some chiropractors online. I'm not one of those. I prefer quality over quantity. The cost of my evaluation, x-rays, first treatment, and the report of findings is only $99. The services are valued at well over $250. The consult, exam, x-rays, and treatment take about an hour. The follow-up report takes 15 to 30 minutes. And remember, all of it is covered for $99. My philosophy is to make it as easy as possible to find out what's wrong and whether or not we can work together. The reason my approach has helped so many is because I don't just throw anyone on my treatment table, poke around, and crack everything in sight. My approach is tactical and precise to locate that main root cause that has been keeping you in pain and eliminating it. This is jumping ahead, but I want you to be clear that my process to find your root cause is just the start. Once located, it needs to be fixed. I know you have tried and failed with other methods. For some patients, I'm the third, fourth, or even fifth chiropractor they have tried. Your primary care might have told you there is nothing else to do but continuing taking drugs. So what makes my treatments different that gets such great results? The same level of care I take in the exam I put into your treatment. Depending on your specific problem, I provide different heat, energy, and light therapies directly at the problem. Then specific gentle spinal adjustments are done by hand to unlock the areas that have been preventing proper nerve and blood flow. Additionally, you may be given specific exercises and home therapies to do to support your care. And don't worry, I do not run the type of practice that traps you into long-term contracts and endless visits. In most cases, your problem has a finite number of treatments and time to meet your goals. After that, you decide whether to undergo ongoing supportive care or stop and return when you need it. The decision is always yours. Is my approach for everyone? No. But for those who do qualify, you stand a very good chance of once and for all getting rid of your pain and getting your life back. If you're ready to discover the cause of your problem and to see if you qualify for the possible solution, apply now. So if you're still with me here and on the fence about whether or not you should apply, I want you to answer 3 questions, and then you'll have your answer. Question 1, will this strategy I just shared get you closer to your goals? Second question, would me helping you with your problem increase your chances of success versus doing the same failed things or doing nothing at all? And lastly, question 3, can you figure out how to make the investment in time and money work for you? If you said no to any of those questions, the timing for us to work together is probably not right now, and that's just fine. Maybe sometime in the future will be better. But if you said yes to all 3 questions, I think you owe it to yourself to at least apply to see if we are a good fit and go from there. Click the link and book your appointment and we can get started.